Hi, everyone. I'm Mikkel Becker, and I'm a lead animal trainer here at Fear Free Pets. And so my specialty is working with dogs, and I've also enjoyed working with some kitties and pigs and other random critters too. And I'm here in Spokane, Washington.
Tabitha, go ahead.
Hi, everybody. My name is Tabitha Kucera from Cleveland, Ohio. I own Chirps and Chatter, cat dog behavior consulting and training. I have the pleasure of working with Fear Free. I'm a Fear Free practice certification consultant and create content and modules for Fear Free. But also, I have the pleasure of working with a lot of shelters and veterinary clinics to help them implement Fear Free and spread the love of Fear Free to everyone.
Hi, I'm Dr. Megan Bauer, and I work at Latah Creek Animal Hospital, also in Spokane, Washington. And I am a Fear-Free certified elite professional, and I see cats, dogs, small mammals, and reptiles. And try to do Fear-Free for all of them.
Hi, I'm Kayla Poisson, also from Latah Creek at Spokane. So I pretty much train dogs, but I'm actually starting to train some horses too. I don't really do cats, but that's her department. And then I've studied for the last about 10 years for behavior, studying other veterinary behaviorists over in the UK. And I'm currently getting my PhD in animal behavior and psychology as well.
I forgot to say my credentials because I was so stoked about Fear Free. So I'm a VTS, which is a vet tech specialist in behavior, certified cat behavior consultant in Karen Pryor Academy, certified training partners, and then I'm low stress and elite Fear Free certified. I just like to share because I know there's a lot of behavior nerds out there who like to learn more. So
nice. And another cat person. Yay!
Yes.
Yes, thank you so much for that introduction, everyone. So I'll go ahead and open it up to the floor to our speakers. They're going to share a little bit of, background information, just high-level tips and tricks before we dive into some specific questions for each of you. So Tabitha, if you want to get it kick-started with I know you have lots of things that you want to share.
So I just wanted to start by sharing, we can talk about this topic in so many different contexts, but we're going to be focusing mostly today in the context of in veterinarian clinics and animal shelters, which does look a little different than in a training session in a home, even though a lot of what we're discussing will be applicable. And then also, I think it's really important to remember, because we commonly hear, but my animal's not food motivated, or my cat is not food motivated. And the good news is food is a primary reinforcer, and that's just lingo for it is essentially something that innately animals like. We don't need to teach them to like it. So usually they are things that serve needs. So food, going to the bathroom, things that are just inherently reinforcing to us. So, but that doesn't mean your animal is going to always eat. So I always like to share a few reasons to why your animal may not eat, but food is a primary reinforcer. So technically, all animals and humans are motivated by food because we need it to survive. But of course, we have to consider context. And a lot of animals may not eat in the veterinary setting because the biggest one is they're going there because they don't feel well. And if you're nauseous, painful, you don't want to eat. Also, if the environment is scary, which even though there's amazing veterinary hospitals implementing Fear Free everywhere, I get afraid when I go to the doctor. My heart rate goes up. There's physiological changes that I can't control. The dentist, it's worse because my previous learning history. So we have to consider we're in usually a new environment. There's loud sounds, there's smells, and then also we're doing things that may be uncomfortable to animals sometimes, or they may not like that treat, right? They may not enjoy that treat or that toy or whatever you're offering them. So I think it's just important to remember that food is a primary reinforcer and all animals are food motivated, but if they're not eating, it's very helpful information and it should tell us not to continue to offer them food, especially if they're nauseous or painful or something that you may not be able to recognize. They may also be fearful or stressed. So if they're exhibiting some signs of stress or fear, and you may not be as comfortable reading body language, if they're not eating a treat that in other contexts they really love, that's really helpful data for us as professionals or as a caregiver to be like, oh, it might be that truck's really loud outside. Oh, there's a dog barking that just came in, or my animal's not feeling well. Their teeth hurt, their tummy hurt. So just some things to consider to start.
Go ahead, Latah Creek team.
Okay. So yeah, to build off of what she said, I think it's really important to think about, especially because dogs and cats are different. So with dogs, I always think about, is the primary reason they're not eating stress, or is that just not maybe the best motivator or reinforcer you could choose for that pet in that situation? Because when they are, like you said, too stressed to eat, too painful to eat, that's when in a veterinary setting, we need to step in with some kind of medication. Do they need pain meds? Do they need more fear-free medications? Do they need sedation? Or do they seem happy otherwise, but they just don't want to eat in this situation? As the owner of picky dogs, that's something I frequently face. Like, we don't like these treats. That's not our favorite thing. And in training them, just in my personal life, I've had to find so many other different motivators and reinforcers for them that it helps me bring that knowledge to the clinic and then for my patients as well. So I've had a couple different things that have worked for different patients, for dogs. If you're good at reading body language, belly rubs can work for certain patients, not for others. Massage, again, for certain patients, not for others. If you are very confident that this is something that they're actually finding reinforcing and they're not frozen. Some little dogs like to be picked up. I have a lot of patients who are toy motivated. That tends to be probably the biggest one after food. We have a high FAS patient who you cannot work on unless he has his ball. If he has his ball, he's fine. That is his number one reinforcer. If we have the ball, it's all good. I had a patient in vet school who liked riding on the wheelie table. If he was riding on that, you could do anything. So you can think outside the box. You have to kind of ask the client, what does your dog love? Is this a little dog that likes being carried around? Maybe that's his reinforcer. Is he toy motivated? Is this a working dog? I mean, you can really think outside the box as far as reinforcers go. But yes, the biggest thing would be first determining why. Do we need to find another reinforcer, or do we need to address their stress? With cats, I've had the best luck addressing their environment. If the environment is quiet, they have lots of pheromones, places to hide, places to explore. We have fish tanks for them to watch, just giving them about 15 minutes just to look around and see everything's okay and feel safe. Then they'll usually, a lot of times they will eat after that because they're more comfortable. But even if they won't, they're so relaxed in their environment that they feel better.
One thing to kind of keep in mind too is we sometimes ruin reinforcers for it. So like food, if the only time they get whipped cream is in the hospital and every single time they get injected with something, or, they're going to start associating it with injections, with pain, maybe they don't feel good, and, the smell of things. So we've had several patients where they were so happy to come in. They were really happy. We brought out the cheese. They immediately backed off. We're like, nope, don't like that. As soon as the cheese was away, they went back to being fine. But we sometimes forget that you can poison a certain reinforcer. So food might not be the best for them. We also put a lot of social pressure with food by giving them a treat out of our hand and kind of hovering over them. Or you have a nervous dog who's like, ooh, I do really like that food. And then they come up and they're looking at you and they're like, I don't really know about that. So in that case, more of a game would be the reinforcement for them and not social pressure. So that's kind of one thing that we tend to run into in the veterinary field for those.
Or they love the food so much that you can accidentally do something that they wouldn't consent to because they're eating, and we don't want to push them that far either.
Yep.
Yeah, I think those are awesome points. So like she mentioned, of course, with considerate approach, we avoid directly interacting with an animal. We always want to assess. But a lot of the times I see people get so excited or even maybe some other staff member or the client's friend, and they just reach their hand into the dog's face. And again, we want to kind of just come in, get our history from a distance as a veterinary technician, right? And then I'm going to toss a treat to assess, because also I'm a trigger in many cases. It's not personal. I'm a scary new person. So, hey, I'm going to toss a treat. And then not only do you get a treat, but you get distance from me, which is extra awesome. So yeah, I think that those are all really great points. And first identifying why, and not taking them not eating as what else, like this sucks, but actually taking it in as this is really helpful data. And then thinking outside of the box for reinforcers for a lot of the animals I work with in consulting cases in homes, but also in the veterinary setting. I utilize other reinforcers that aren't food. So it may be with cats, I use scent, enrichment, or reinforcers a lot, especially for medication training, because by the time I'm involved, the cat doesn't like the meds. The poor caregiver can't give the meds. They're not food motivated because they're not getting their meds because their medical issues aren't being managed. So it's really fun though, because you become a better trainer and you become better with these animals, because, I used to not use scent reinforcers with cats as frequently, and now I do it a lot. But in the veterinary setting, this is something you can do too. So of course, silvervine and catnip can simulate an over-arousal response. So that may not be your choice as you're giving a vaccine, but can you do it at the end of the exam? Heck yes, you can. And that's an awesome way to kind of let them disengage and sniff, or even a dog. Like, we're going to scatter treats at the end for you to disengage and smell and kind of let things out, shake it out kind of thing. Or using play. I love the tennis ball example that you use. There's so many dogs out there who with their ball, they are the happiest. Or I vaccinate a lot of kittens playing with them. So someone's playing with them and I vaccinate them in many cases, especially because most kittens don't have past trauma to veterinary exams, which is why it's even more important that we make those first exams really positive. So it can be challenging to sometimes find those motivators, but we talk to clients, we ask their feedback, and a lot of clients don't even realize that play can be reinforcing or scent can be reinforcing. So then you're also planting seeds for these awesome caregivers to maybe play with their cat more. And that basket of toys for 5 years, maybe not enough. I'm a little biased towards cats and everyone's health. Poor cats, everybody. Because I think so often I go into vet hospitals and I love that they have a variety of treats. I think that's awesome, because we all should have a variety of treats, but then I'll see the cat treats and it's like 2. So I think we just have to realize that we should provide a lot of different things. And then the last thing I'll say, because I do think we should all share our favorite cat and dog things, because I'm sure we all have tons, but I think the way we present the reinforcer is also really important. So the biggest tip I can say is before, during, and after. So in many cases, we're giving a vaccine, the veterinarian's communicating they're going to give the vaccine, and then you may come in like this. So instead, we should, of course, usually feed like that, because this is pretty alarming, even if it's something they enjoy. And also safety first. I don't need my hand or face in the face of another animal. So I like to feed like this. But also you want to get that toy, that licky mat, that treat before, because does the animal actually enjoy this? It allows you to assess, is there a decrease in FAS? And that's where body language is such a big part of this. First off, do they actually enjoy this? Is there a decrease in FAS? And then of course, during, and then after, to kind of end on a positive note. And a few of my favorite treats for cats, we all know they don't sponsor me, but Churu, hello, I'm Tabitha.
Yeah.
I love Churu. A few others that I have had, and I'm thinking high value. So we're in a veterinary setting, it's scary. So really high value, special stuff. Whipped cream, which is actually really reinforcing for dogs too. But I would say Churu, whipped cream, and then a shoelace toy. So only under supervision. Tell your clients we do not leave cats with shoelaces, but shoelaces are the best toys ever. and they are very affordable and you could buy them in bulk. And then for dogs, I would say, I mean, I feel like there's so many options. I like lickable things. So peanut butter used to be a go-to, but like you mentioned, a lot of dogs have their peanut butter love may have been poisoned a bit because if an animal's exhibiting signs of like FAS 3 to 4 and you're like peanut butter and they're eating, it's just because they're eating it, it's not appropriate in that context to be feeding them peanut butter. So that's a little more complex, but just some things to think about. What are your favorite treats and other tips?
Okay, my favorite treats for dogs, probably either the freeze-dried liver, if you're looking for something dry, squeezed cheese or whipped cream for something lickable. They, a lot of times will get, well, should we be feeding them squeezed cheese? Like, please don't at home. Let it be something special. And also, it's not the healthiest, but it's okay. It's okay for a couple times a year at the vet. Those are my favorite lickables for dogs. It's really fun to make the whipped cream into a pup cone too. Clients really love that. Dogs really love that because it's a little bit novel and then they can eat the cone. They usually haven't seen that before, even if they've had whipped cream before. So that's a lot of fun. And for cats, of course, churro. I think we're all going to say churro. But squeezed cheese is actually really fun for them too, because I think it's also so novel for them that even if they don't eat it, they want to explore it, sort of like the scent reinforcers that you were talking about, that they're so curious about it that sometimes that just gets them out of their stress and just interested in what this weird sticky thing is you've just put on the table that kind of smells good.
So my favorite for the dogs would be the whipped cream. I think that's pretty good for the puppies, especially. I also use a lot of like tracking and tossing of the cookies, like back and forth in the room. That will help de-escalate them. But I'll actually set up like the whipped cream or the cheese in a little path throughout the room as I go get the doctor. So that way too, they get to explore and they get a little bit of reinforcement before anything scary happens. So whipped cream and cheese is good for that. I also really like toys, the squeaky kind especially. Most dogs, even if they're nervous, that sound kind of just will break that focus real quick, and then you could get them onto something that they like. And then for cats, churro, that kitty crack everyone loves. But I actually been doing a little bit of like the potted meat for them, same with the dogs, and then I just crinkle up a piece of paper. And that would usually do it for especially the kittens. And it's super easy. It's cheap. There's been a lot of cats lately who have not been interested in any of our toys. I'll just crinkle up their check-in sheet and they'll play with that for like 15 minutes.
So hi again, Mikkel. This is Indiana Bones, by the way, who's joined me. He's such a love, so I have to introduce him, my little man. So some of my favorite treats I'll start off with, since we were on that subject. So I wrote them down because there are lots, but I really like pub cheese because you get like the big like can of cheese and like it's awesome. It's really easy to spread and a little goes a long ways. I'm a huge fan of like different meats, and so a lot of times we can like create little packs or like the little tiny kind of like to go cups, so you can already have these like pre-done in the freezer, pull them out. So that works really well, like salmon, chicken breast, lean steak, deli meat, and especially heating them up so you get that aroma too. So that's really helpful. And also really like liverwurst. I don't like it because personally it really stinks and it smells up the whole room, but dogs go crazy over that. And some of those hot dogs, so both with the liverwurst or hot dogs, sometimes you can also heat those up in the microwave, so those can be easier to deliver, less sticky. But some of those you can also smash into something, so you can have it more of a lickable treat. And then also baby food, and then they have more and more of those squeeze packs for dogs. So there are some, and I can't think of the name right now, but I'm going to run and grab one as we're talking, that my dogs have really gone crazy for more than anything. So I love that, and it's perfect. I was just doing some basket puzzle training yesterday, and it's perfect for that. And then my other go-to treat is from, I think it's 3 Dog Bakery, but their peanut butter cookies are fantastic. And I had to try one on a dare one time. I didn't have to, but of course someone dares me, I have to. And it tasted great. So I'm like, no wonder the dogs are crazy about these. Like, and even the pickiest of dogs, I like love them. So those are the best. And then, so one thing that I always look at, if a dog is acting, or a cat, if they are very hesitant about eating, is looking at like, how are we feeding them? So looking at, are we giving it directly from our hand? Maybe sometimes having the owner start giving treats, that can be helpful, placing it a different way. So that's one thing to consider. And then also considering, are we treating, as I know you kind of alluded to this earlier, Tabitha, but like, are we treating before, during, after? A lot of times we are kind of waiting until the stress is building up before we start treating. So we need to make sure we're treating all throughout. And so, from the parking lot into the exam room, like that whole walk. And as they're settling in there, like at Latah Creek, you guys are great because you have like little treat stations where the owner can be giving some nice little treats for them to be keeping them calm. That's perfect. And always watching trying to reduce any of those FAS triggers. So any stressors like noises, like sometimes it's just another dog walking past, or another dog shaking off, or a cat meowing. Like those things are so stressful. So paying attention to like, where can we minimize some of those stressors that are reducing that pet's desire to eat because they are getting more stressed. Probably the biggest thing of all that I see when food doesn't work is when we're relying only on distraction rather than also looking at like touch equals treat type of timing. And so for a lot of pets, Indiana bones included, they can get somewhat almost like wary of that. Okay, they're doing the food distraction whenever they do this, because maybe they're not used to that at home. Or whenever this happens, they get poked. So that's one thing I actually just practice proactively, is getting my dogs and cats comfortable, getting them comfortable with distractions, and nothing bad happening. So we're just petting, they're getting the distraction. But there are some dogs, like whether it's, resource guarding issues, some pets just like us, we want our own space, and it's really uncomfortable to have people in our space when we're eating. And I think pets are definitely the same way. So that's where that touch equals treat type of timing is really helpful. And that's something where, definitely scheduling some victory visits if we have a pet that has really high FAS, and maybe doing some home care too in some situations. So rather than progressing, we're stopping, we're reevaluating. That might be where we actually, are looking at, okay, we need some victory visits to help us get to that point. And those actually can really help take the pressure off of us, and also take the pressure off of the pet and their guardian. Because a lot of times, what I found is a lot of times, like the care that we're looking towards, we end up getting that done in some of the subsequent victory visits themselves, which is really cool. And a lot of times just because everything's chill, like we're relaxed, way less pressure, which is awesome. But even during the session, and this is something my dad, Dr. Marty Becker, and I were just looking at this, even with our own dogs, like where sometimes if a dog is starting to hesitate, or a cat, if we're doing any of the vaccinations or things like that, sometimes it's looking at, okay, how can we move this from distraction? Can we go to touch equals treat? So when we're doing touch equals treat, we are also throughout, we're always using that touch gradient, but we're also doing that fast desensitization and counter conditioning. So we're slowly building up to that procedure that we want to do. So, if it is like a vaccination, for instance, and the pet is hesitant with eating stops and pauses, that's maybe we're just going to do a little bit of petting, we're going to treat. We're going to do a little bit of petting, treat. Also be aware that sometimes the added reward for some pets is hands off. So the removal of like holding them or touching them, that's another aspect of that reward. So it's that negative reinforcement essentially for they're getting the hands off, they're getting space, that relief. So that's another aspect that we can add in. So when we're doing that, and say that we're coordinating it with somebody, or we're just doing it with the pet, we can say our word like treat or food, whatever it might be, and then hands move off, they treat, and then we start again. So it's using that touch gradient. And for some pets with touch gradient, it is helpful to keep hands on, but for those that really want that space, that is a really big reward for them to get hands off and that pressure, that relief of that pressure. So really moving to the touch equals treat, I think, is super helpful just in general with pets, and doing that on a proactive, preventive basis, but also interventionally, I think it can be really helpful.
I'm really glad you brought that up, because I've been meaning to ask you about that. So I guess now's the time that I make it into a kind of a game with some dogs where, like you said, some love the touch gradient. I really want you to just be very slow and just very gentle. And some want to kind of hold still and wait, and then, okay, and then they play with you for a minute. And then it's like still and play, and then that becomes the game. And then that's its own reward because I get like to play for a second and shake it off, and then I hold still again. I'm kind of waiting for it, and now it's fun because she's going to release me, and I'm not really thinking about her flipping my ear. So I've had to deal with that too a lot of times. Even if they won't eat, just the release and play then becomes its own reward.
Wholeheartedly agree.
Yeah, I just think from a non-food motivator, because we're kind of touching on a lot of them. So when this could be that social pressure, so hands off or distance away from the animal or a play break. So these are motivators and reinforcers that I don't think that we realize we're doing in fear-free care that a lot of you are already doing. So for example, when we're doing an exam and vaccines and blood work, we don't go through those in 5 minutes. Even if the animal's exhibiting minimal to no signs of stress, I'm probably going to take, 10 to 15 seconds between the vaccine and touching the dog again. Or maybe I may have hey, I'm going to talk to the clients really quick while they go smell around. And like she was mentioning, we're going to toss some treats around or do a play session. Or another big motivator is I always tell my caregivers to walk your dog outside and have them go to the bathroom prior to going into the vet. It's every vet hospital is set up differently, but going to the bathroom is so reinforcing. If any of you have ever held your bladder in an airplane, so like there's a lot of little things we could do to provide opportunities for reinforcement, even when we're not handling as well.
Thank you so much for that great discussion. That was really great to go around. Oh, Mikkel, you have your treat pouch or your lickable that you have.
Nice.
Well, Mikkel, we can't quite hear you.
Sorry, there we go. So this is my little dollar store caddy of different treats. So one thing I know that we didn't necessarily mention, but I do really like are the little baby foods. So, having a little variety in the little sausages, especially the Vienna sausage, like baby food types. A lot of pets really love those. But this one I think has been the canine crack so far. So it's Pure Bites and all their flavors are amazing. Like they were preferring that even over churro, which is crazy because pets love churro. So definitely worth trying.
Perfect. Thank you so much for sharing that. So I have a few questions that I've kind of collected through the chat and that were submitted beforehand. The biggest question that I've been kind of seeing is what are some of your favorite non-food motivators or alternatives that you'll use for those pets that, you're offering the high value treat, but for some reason they're still kind of turning away?
Go, Kayla. Okay, I'll go. So I use a lot of like play for them, just games in general, get them moving, get them sniffing. If the dog is super scared in the veterinary room, great, let's go do it outside. Go get them sniffing in the grass. Go get them sniffing around the cars. Kind of anything, just kind of get them moving. Dogs really struggle with stillness because we teach so much confidence in moving. So staying still in an enclosed room could be really hard. So just kind of get them out and about. Then you can do all the sorts of different toys. You can use like different scents. With my working dogs, I use a lot of scents like birch and oak and things like that for them. Also, sometimes I'll just get like a used cat blanket and then they're like, turn that into a little snuffle mat or just get them really into it. And they're like, whoa, this is different. This is weird. And then that will kind of break them out of their shell a little bit to try something else or to get them moving. And then just use like the physical affection if they like it, release pressure from them, like the holding like we talked about earlier. And then safe objects. I have a dog who does not particularly like anything, but he will work for a sock. If he has a sock in his mouth and he doesn't eat it, he's not allowed to have it without the owners present. But that is one thing. He's extremely dog reactive. So if you whip out that sock, he's good. You can do whatever. He can go near anyone. But as soon as that sock's gone, then it's like game over. He's no longer doesn't want to be there anymore. So just like Dr. Wing said earlier, just thinking outside the box, you can really use almost anything as a reinforcer. It's just going to be up to that dog on what they find reinforcing.
For cats, since we work together, we probably do a lot of the same things for dogs, but For cats, will you hand me that? It's actually even in here. Getting a blanket like this, I don't know if you can see, this is one of those really, really fuzzy ones that I've had several cats who just want to sit and knead on that. And that was very reinforcing for them, these were, like you were saying, the sick ones. They couldn't or wouldn't eat because they just really didn't feel good. And they just love sitting there. They love looking out the window. They love, like, if you don't have access to a fish tank, you can get those little plastic ones and put them in a bowl of water and let them flutter around. Bird TV or cat TV is an even cheaper, easier way to do that on an iPad or a laptop. Again, with supervision, because our clinic cat knocked all of the monitors off of our front counter when we left her unattended with Bird TV. So be careful, but they find that very rewarding, especially kittens love to watch birds or fish flutter around. So something like that can be really rewarding for them. I know a lot of cats, they love their pheromone spots rubbed too, if they're friendly, but just not feeling like eating. That might be very rewarding for them also.
Yeah, a few of my favorite, a lot of them are similar. So a few of my favorite non-food reinforcers for dogs is, especially because for context, I mostly work with FAS 3 to 5 animals because I'm a consultant and I teach a lot of cooperative care with really fearful animals. So context, but it is very reinforcing, even though we're working to help them be more comfortable with touch, to not be in a stressful environment. So like she was mentioning, we do a lot of our exams outside or in the car and kind of get them away from those small spaces, give them opportunities to sniff, whether that's grass or, again, you can buy so many scents. You can get weird out there. Dog specific scents. I had one client, again, it's all about what that learner finds reinforcing. And we know with these fearful dogs, like I understand that they're really fearful. So we weren't going to use food because they needed something, unfortunately. So this dog had some medical needs and we couldn't postpone the medical procedure due to that. So I was like, my friend has a gerbil and she has a rag in there that I asked her to put in there. And we're going to bring that rag, not the gerbil, to this dog's vet visit. And we did it in the backyard and we did a walkthrough with one of the staff's dogs first to help the staff be more comfortable because it was a sedate and poke, like follow the dog as the caregiver walks. But it worked better than I anticipated. We were doing our best with what we could do in that moment because that's a lot of our job, especially working with some of these really fearful animals where food wouldn't even be appropriate to give them. So I think scent reinforcement for dogs is great, but also just not touching, like, hey, we're going to take a break. A break can be, because people are like 5 minutes sometimes, but sometimes a break can be 15 seconds. I don't think we realized, like when I was a baby tech, I think I was just doing everything very quickly and I didn't even think about it. And now my brain goes to, if I was getting blood work and I had minimal to no signs of stress, which is unlikely, if they drew my blood and then looked in my ear and then looked in my eye, I would advocate for myself and ask them what they're doing. It would be strange if there wasn't like some subtle break. So I think that break and distance from us, which is why, for example, if you note that a dog is having some signs of stress, we're not going to have 3 techs. And let's say the client already has 2 of their awesome kids there and the vet's there. And then we have 2 techs that are coming in. Maybe we're going to just see if anyone's in the lobby and maybe do the exam there. Because some of you may not have a backyard that's safe to do an exam in. But we're going to come out of that room because we all know I love 2 kids, an adult, a vet, an awesome tech, an awesome trainer. That's a lot of social pressure. So I think, and then toys, of course, toys are huge for dogs. In emergency situations, I will sometimes, so this is more of a distraction than a reinforcer, but these can be used in different ways. Sometimes when we're actually sedating the dog because they have needs, I will have people strategically squeeze a squeezy toy at a distance so the dog will look this way and then I can poke on this side. So we're getting them to move this way. Ideally, they have a basket muzzle on and all that stuff. But you can get really creative with some of the distractions. And then for cats, I love heat. I do victory visits with cats, and I will never forget this cat. Her parents were doing a wonderful job. It takes time, a lot of time, to change past learning history and negative associated conditioned emotional responses. Just like it's going to take a lot for me to get over the dentist. I'm still working through it. I have a therapist. Yay. But we were working with this cat, and we were controlling the environment, which we should always do what we can to minimize stress and not just use a distraction or just a PvP. It's a team effort about the environment and how we approach the animal. But we had a hot dog, which we use in anesthesia. And I was like, let's just plug it in and put a blanket over it. This cat's FAS went from 4 to 1. And I have a lot of cases like that. And I'll be honest, that's not something I used to think of. We were just trying. It's just the more you critically think and get creative, the more experience you have and the more things you can do in the future. So now I have my cat's heated cat bed comes to her vet visits. And I tell a lot of my clients, let's get a heated cat bed. Or if you're in a vet hospital, most of us have bear huggers, hot dogs. Hot dogs are already kind of like beds, so they're great. But that's something that you may have not thought of, just like the fleece blanket she mentioned, which I think is great. I also commonly do the petting here and the scritches. I have one cat that I do butt scritches. That's their high value reinforcer when they get vaccines, and we draw blood on a cephalic because butt scritches are the reinforcer. So as you can imagine, a jugular or a medial saphenous, probably not best. So yeah, petting, heat, and then outdoor views. A lot of vet clinics I'm working with, I love, they're either making their exam table up against a window and they have the window open in this. It is so reinforcing, and also vertical spaces in general. So this could be an exam table, but there's so many amazing vets out there who are creating vertical spaces for cats, and that is so reinforcing. So those are just a few. We can all go on and on.
I would also love to share something we tried that didn't work. If any of you out there are thinking, well, gosh, if going outside is good, and if staying with mom and dad is good, maybe keeping them in the car would be good. We did that for a while, and then it dawned on us one day that, I think it might have been Kayla, but it dawned on us one day that, we're actually creating negative associations with the car. And that's going to get us into situations where they don't want to get in the car because I think they're going to go to the vet and get a vaccine or get sedated or get an exam or something. So now we've started taking them out of the car so that they have that comfortable place to go back to, and it doesn't poison it for everything. And just like when you talked about poisoning the food earlier,
Yeah.
it poisoned the car too.
Yeah, I noticed I was getting a lot of comments from my behavioral clients that I'm seeing here, and they're like, well, he used to really like the car. Now we tried to get him to load up, and he wasn't. I was like, oh, I know exactly what happened because last time you were here, it was sedation and not the training. And so a lot of them have been noticing that. And so as soon as we stopped sedating in the car, we've noticed a huge change to where they're much happier going back. And with the few select patients that have to be sedated in the car, like that truly is the best. Maybe it's we poke them while they're jumping into the car. We make sure that we send a little training plan home with the owner of, please, work on good associations with the car. Please take them out and about to many different places and not just here, especially if this is the only place that we can sedate your dog.
Yep. Now we have he didn't like the car to begin with, but we do have a 150-pound dog who now won't get in the car at all. So not just to come to the vet, but at all. So he didn't like it to begin with, and now he extra doesn't like it. And we didn't even do anything in the car. It was just he only got in the car to come to the vet, and now no car.
Mikkel, you look like you wanted to add some.
Yeah. No, I would just add, I love that you guys work with such high FAS dogs. Like, I know that you guys you guys get them all. So I can just imagine.
And cats. We love our high FAS cats
Yes.
too.
Exactly. So just a couple things to add. So one other like fun little distraction that has worked well from at some of the clinics that use it are crickets. So just like a little thing of crickets that they can like see and it's moving around. Like it's just different and novel enough that it kind of can get some attention. And then also the owner, that's one thing I was thinking about. Sometimes like the pet may be wary of taking something from somebody else, but from the owner, it's different. Or maybe there's a certain way that the owner pets them or talks to them that like really is very calming for that cat or that dog. So utilizing the owner when they are in that space and they're comfortable and they're actually a calming presence for them, that can be really useful. And the other thing I was just going to add, and this is more like for victory visits that are helping to prepare that dog. And I haven't used this specifically with cats, but I would imagine it could potentially work the same way. But being able to give them that opportunity of exit and practicing that exit. So that retreat from that scary thing. So like for some pets, it could be like going in the vet hospital, like just walking through the doors, or it could be walking into the exam room or approaching the scale, approaching a team member. So it's like using little aspects of that. So which is a certain training technique where we are reinforcing a reward worthy movement with both space. So moving away from that thing. So in that situation, if you have the dog on leash, it's like a good or treat. And then we are moving back like 10 feet and turn it into kind of a fun little game. And so doing this in dog classes or in the vet hospital. So we move back 10 feet, we practice that, we give the treat there, and then we give that opportunity to approach again. As soon as they do that, maybe we move a little bit closer, just like another step, and then good. And then we get to, retreat back again. It's that fun little game. And a lot of times, like for those pets that aren't even taking treats, and sorry, Bones wants up right now. I'll pick him up in 1 second. 1 second, honey. That's a reinforcer for him. He loves sitting on my lap, being up here with me. So definitely, I feel like that's a great game that for those pets that are hesitant to take treats, that it almost always will get them taking treats. So that's kind of a game I think about introducing, especially for a victory visit.
Well, I feel like if a cat owner wanted to kind of start playing that game at home with their carrier too, then that could double as reinforcing carrier. Like,
I love that.
You love getting in here, you get your treats in here, this is your safe space, and then that could be their exit while still keeping them safe in the room without actually having to open the door. So that would be a great way to then double up on training to get them to love their carrier too. I had a cat who did that herself today. She's 17 years old. She's been to the vet plenty of times. When the exam was over, she just walked and put herself in her carrier. Like, that's it, I'm done.
Mm-hmm.
So if they love their carrier, that'd be a great.
I like that.
Reinforce them.
Thank you so much for those answers. I think there was a lot of really great resources there. One kind of common question that's been in the chat when you talk about the scent reinforcers, you talked a little bit about some of your favorite dog scents, but what are some of the scents that you use for cats, and how do you present those? Do you present them the same as like a treat, or what does that look like?
So in my experience when I'm presenting, so I use cat grass a lot. Or I know this sounds silly, but I'm all about bringing the outside in as just enrichment for cat caregivers. So I'll bring in some pine cones from my yard. I'm aware of the chemicals, right? We have to consider common sense, of course. We're not going to want to go some random place and bring something in that we're not aware of. And we're not going to allow the cat to ingest the pine cone. But I'll have things like leaves is a big one that I find cats really enjoy because they're really wet and smelly and gather a lot of scent. Dogs do too. But so I'll literally, it sounds silly, but I'll put leaves in a box and they can smell them. And I may or may not add additional scent reinforcers. Like, again, I love valerian root, catnip, silver vine, dandelion root. There's so many amazing. I have a handout. I'm giving consent for you to email me and I can send you even more because I would love more people using scent reinforcers for cats. But again, catnip and silver vine and valerian root can sometimes cause a excitement response, and understandably in some contexts we don't want that, but it would be great for the break or afterwards. So I'm a big fan of bringing the outside in, and fresh air. So I mentioned having the window open. I'll be honest, there's a few clients. I'm in Ohio. The vets I work with are amazing. And I'm like, we're going to open this window for this vet appointment. Because just that fresh air is so reinforcing for dogs too, but for a lot of the cats I work with. I do this in homes too, where we'll just open the screen door during certain types of training. So those are a few ways you just present it and allow them to interact with it, however that may look. That may be them engage, like I'm going to approach it, smell it, and walk away, or I'm really going to get into it. And then you can then start a touch gradient and maybe do your vaccine or your exam. And then cat grass, that is something that they'll probably chew and ingest and smell. So you can, the one shelter I work with, it's the cutest thing I've ever seen. Those little mouthwash cups, everything smells cute, but they have a little bit of dirt and little catnip plants for the cats as enrichment. Not only is that going to look great on your social media and educate clients about the need for cats to have more enrichment, but it's also going to be awesome enrichment. So you can even plant, I work with a lot of shelters that grow catnip in their backyard, like on their premises. And you could do that as a vet clinic and then just, here's a piece. And a client's going to remember that too. So that's an awesome thing. I'm trying to think if there's any other ways I would utilize it. Those are just a few ways. So
I was just going to throw in just one little tiny thing is honeysuckle wood. That was one thing my dad was taking to some of his exams. So bringing honeysuckle wood. So giving each cat, the opportunity, and a lot of them were super into it and like really interested. And if nothing else, at least sniffing or kind of like rubbing up against it. Some of them, go on to chewing it. So that was kind of a fun thing.
And then Feel Away, of course, is a scent that we all use. I wear it as a perfume every day. I'm sure many of us do. It's great. So that's something that you are already utilizing most likely in your practice. And that can be really reinforcing for cats, or you may have a plug-in. And also I have utilized gerbil scent and other animal scents, small mammals, where my friends happen to have them. And I'm like, can you just put this little tiny rag in here for a minute and then throw it in a Ziploc bag? And it's really great for cats. You'll get some focus and they'll be just going to town with their nose into that rag. And I can do my vaccine. I can do my blood. It's wonderful. And it's easy to present because it's just on a rag that can travel.
Perfect. Thank you so much for those answers. So one other question that I thought was pretty interesting was what can you use as motivators for a dog that might be a resource guarder or that is having resource guarding issues, whether it be over the food or maybe a toy, that sort of thing? What would you recommend in those situations?
Tricks. A lot of dogs really like to do tricks because we get kind of bland and boring whenever we teach obedience. Sit, cookie, sit, here's this. Whereas tricks, we throw a big party like, oh my God, he did a paws up. Oh my God, he turned around, or oh, he shook. And so dogs kind of get that dopamine boost in their head whenever they do a trick, just because we make it such a party. So for all of my resource guardings, because I see a lot of FES 5 dogs, that's kind of my specialty. And so recently, actually, we've had a lot of resource guarders in, and we've been using a lot of kind of pressure on, pressure off, and then tricks. So one thing that we do for all of our nervous patients, FES 3 and above, who really don't do well with the visual, we have them go in a middle position with the client where they're in between the client's legs and we come up behind, and then the clients can kind of just love on them, give them pets, and then big release, big play afterwards. And then we go right back into position, or we ask them to jump up onto the bench or jump up on a rock. And then we kind of will take the pressure off and be like, okay, now we get to do that exit strategy. And then we come back. So that's worked really well with the resource guarders.
I would just add for me too to some of those ideas. So definitely almost always moving away from that distraction. So having that continuous food distraction and looking more towards the touch equals treat can be super, super helpful. So that in and of itself can really help. As much as we can, looking at trying to change that emotional response around resources and making it one like where it's like, okay, when they come close to me with this, like some really, really good stuff happens. And like, it's for whatever reason, that's like one of my favorite ones to work on. It's just, it's fun. It's fun to see like that response change. And a lot of times they just haven't really been taught any different. So it's like actually, you know, building in like that, instead of that like scarcity mentality that something might be taken away, it's like, oh no, something really good's going to happen. Like, you know, building that really happy conditioned emotional response. But I also think that with dogs that are resource guarders, it can be really helpful to teach them those behaviors where they initiate that first contact is super helpful. So both like the touch where we do like a nose target, but the one that I really like is in terms of handling is like a hug or a love skew where they actually learn to target their chest into your hand first before you then start your handling. And I've also found it to be really helpful to give them those predictor cues. So like maybe just a general predictor cue of, okay, pet. And so then we're petting their body. If they have specific areas, we can teach them like, you know, their ears. We're saying ear, moving to that area, we're treating. So a lot of times if they have that awareness of, okay, this is what's going to happen, a lot of them, it's just they're very wary, you know, sometimes like quick to snap or quick to kind of go into that aggressive response. So, but one way that we can help them is by giving them kind of a heads up and a positive heads up, because we're pairing with those positives of what's going to happen next. So that's been really helpful too.
Thank you so much for that insight. We only have a few minutes left. So one kind of common question that I've seen in the chat as well is kind of how do you get your other staff members or other people that are around you to kind of get on board with trying alternatives away from treats, or maybe trying like the higher value treats. And then from the pet parent perspective too, how do they advocate for their pets if they're going to the vet and, you know, saying, hey, this is actually better for them? You know, what can those conversations look like?
I would say just leading by example to get your team on board. Probably it's one of those things where they may think, oh, it's easy for you to say, but that's not really going to work. But if you can show them how well it works, I think it would motivate everyone to want to try it. You know, here's a dog that person A couldn't touch, and then person B goes in there and spends 15 minutes and gets the whole thing done stress-free. Nobody gets bit. I mean, I think that's the best way, is really just showing everyone how it can be different.
Yeah, I second. Leading through example is how I essentially implemented fear-free into many of the low-cost vaccine clinics, general practices I get around, multiple environments, because either way, you're doing the best you can in that moment. And that's something you can control, because ethically, I understand that this can be challenging for all of us for a variety of reasons when we're seeing a stressed out dog and someone that may have not learned the techniques we have, even though I'm sure they're coming from a good place because we all love animals. That's why we're in vet med, but it can still be challenging. So I think the biggest things I've had positive experiences with as far as implementation is leading through example, doing our best to not judge and jump at people. Like, don't do that, even though I know in your heart you're feeling away, and I empathize with you. But we also, especially behavior nerds like ourselves, we understand how humans and animals learn, and that is not the most effective way to teach. And we love humans and animals. So I think learning through example, not judging, and then showing, like she mentioned, but I kind of take it to another level. I usually ask a tech, or at the practices I worked at, they wouldn't give me an hour of the staff meeting, but I shape behavior, right? We break it down into small, realistic steps to set the learner up for success, whether that's a human or an animal. So I was like, hey, can I have 5 minutes? And the doctor was like, yeah. So then I shared 5 videos of me vaccinating kittens while playing with them. And then everyone was like, and that doesn't mean it's going to work for every cat, but I'm just trying to change the narratives that many of us have been conditioned to feel, whether we're talking about, you have to realize when I show some of these videos, sometimes I think a lot of us haven't ever experienced that. When I first saw Sophia Yin speak very long time ago, I remember thinking in my brain, I don't know, I'm super stoked about this and this sounds great, but I don't know. And I'm very open-minded and happy to learn, and we're not all in that place. So I think showing, because also having I have a bathroom caddy. Ideally, the clinic would have provided that, but I'm going to be honest with you, I bought my own stuff to start. because I was that girl. I got my VTS in general practice. So I had a bathroom caddy, and I started to recognize what most of my cat and dog learners found reinforcing. So I started to just hold that. And then as the tech, I would go in the room and start to utilize those things, and the rest of the staff noticed. And then I actually started getting, this was a big way to get motivation, but clients started essentially when they were calling, they weren't like, I want to see this specific vet. They were like, I want to see this specific technician. And that got the owner's attention. So there's a lot of creative ways we can do it, but I think showing and then sharing videos and maybe talking through how this would work, and saying, what has everyone else done that's worked? Like, what does your dog love at home? And kind of starting to open the conversation instead of being like, look at this thing I do too.
And if you're a pet owner, kind of wondering how to advocate for your dog, or cat, because that was the second part of the question. One thing that we came up with at our clinic was to make our really high FAS patients little laminated cards that say what works well for me, how to handle me, how to have the best visit with me, and with what works for us. For some, it's just stay on arrival, don't let us escalate, or use these types of food. And then our hospital manager reached out to the ER to let them know about the cards and would they please accept them. But even if they're going somewhere that has no idea, it might help the less confrontational pet owners, and you can make it yourself as a pet owner. Here's what's worked at the vet with my dog in the past. They always sedate him. And then it's something that is a little bit easier, maybe just to hand to someone, than having to try to say, you have to stop, which is hard, to get ahead of it on the front end. Like, here's what works best. Can we please do these things and have a good visit for him?
And so along with so you're talking about the little bathroom caddies. I'm now calling it my snackle box. So like having like different snackle boxes that you take around, and also having toys in there. So we can have, like, especially if you're going to kitty room, you can have a variety of different toys. So that's a great way. So you have, and also have some of your scent enrichment. Like, you can just have it all kind of right there at your fingertips and easy to access. And as you mentioned, like being able to have a record. So having that emotional medical record where we have these are my favorite treats, and also asking the owner to bring those in. So maybe it's like that reminder, maybe they have something really special. Their dog is like crazy about those sausage patties from McDonald's, whatever it is. Like some dogs, like my friend's dog that just loves ice cream. Like that is the top thing in the whole world. We'll do anything for ice cream. So bring that on in, or we have it there in the clinic.
Yeah, and I think when we're asking our clients what their animals love, which I think is super crucial and a great way to start the conversation, I think instead of saying, I experience this more with cats, I'm just going to be honest, but I'll say, what are your cat's 3 favorite things? And then I always clarify to provide more helpful criteria and to encourage more open-minded thinking. I say, it doesn't need to be food. It could be sitting on your lap or sitting in this sunbeam. So I give examples that aren't food, because I think a lot of caregivers, because even, again, the dog or cat loves this treat outside of the context of a hospital, but there are a lot of stressful stimuli, even though we're trying to control it, in a veterinary setting. And ideally, it would be awesome if we had non-food motivators already in their record that we could utilize. And so many clients are like, yeah, he loves sitting on my lap, or he loves a sunbeam. And the fun thing is, I can make those things, I could recreate those things, or we could just examine the cat on the client's lap. We could get a beautiful fleece blanket and have it in a round bed that simulates a lap. You can get so creative. But sometimes I think we have to help clients understand that their animal may enjoy, like, even understand that other things are reinforcers, because understandably they aren't aware of that. They're just like, he likes this treat, or my cat doesn't like any treats. And that's where you say, what are your 3 favorite things? And then I might give examples, and then they always give them to me. Like, it might be sitting out in the grass on their harness or whatever it may be. And then you can do your best to simulate that in a veterinary setting.
Perfect. Thank you so much for all of that insightful information. I know the chat is just going crazy of like saying, oh, I agree, and like bouncing ideas off of each other. So thank you so much for that insight. And we've hit time somehow. The past hour has flown by. So on behalf of Fear Free, I want to say a huge thank you to all of our panelists today and each of you that joined us.